The Integrated Outreach Program is a program that was developed by government with the aim of taking services to the people. You would note that in terms of South Africa's history is that 10, 20 years in terms of its democracy is that services were very fragmented. Most of the services were centralized within the urban areas, and most people within the rural areas were excluded from services because of poor infrastructure, and government had not had sufficient footprints in those areas. In order to speed up services and improve the way services are delivered to people, there was an initiative aimed at ensuring that all the ministries within government would then have what we'd call a local term, which is imbizo in South African language, within the local language, which simply means that it's an outreach program. And I think the program is driven mainly by the ministers of the various government departments at national and provincial level. And at district level and community level, it is then facilitated and driven by administrations within the various ministries. From a SASSA point of view, we call it an integrated community outreach program because SASSA would take the lead in terms of taking the services to the people in the context of providing social assistance, but in partnership with ministries like education, ministries of health, ministries of death and birth registration are responsible, and they're key stakeholders in terms of having to work with the agency in terms of accelerating services. The Department of Health is responsible for providing assessment for beneficiaries who might be eligible as a result of their disabilities. Hence, if we then have the outreach program. So what you have in essence is a one-stop mobile service where a customer would walk in and be able to access all government services and leave rather than being referred or pinpointed to various others. So the whole program in itself has been very successful in a sense is that we would get into the area, we would provide it obviously with a mobile truck that is fully capacitated with all the necessary equipment that we need. Your satellites, your 3Gs, your computers, your administrative, your personnel. And I think in essence is that we've taken the process one step further. If people are unable to come to us where we're in the communities, we then go to their homes and then we would say that we would provide any services. We've also taken a step forward in terms of where we've, in essence, gone to institutions where aged people live who are unable to come to us. We would then service them. We've gone to children's institutions. We would go there and service them. We've gone to the extent of institutions where people living with disabilities who are unable to come to us. We visit those institutions. People who are over 75 years of age don't come to us, we go to them. So that is the program, what it's all about. It's taking services closest to the people so that those who are excluded can, in essence, benefit from the program.